Welcome to Urine Good Hands, the podcast where we dive into everything urology. Leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice. All right, let's dive into a topic you guys specifically requested. Microscopic hematuria?
Yeah, it's a bit of a mouthful.
I know, right? But it's important.
Definitely. It's basically blood in your urine that you can't see with the naked eye.
So no need to panic if your, toilet bowl isn't turning red.
Exactly.
But it's definitely something to pay attention to.
For sure.
Our deep dive today is based on some awesome information from the folks over at Advanced Urology.
Really the experts when it comes to all things, urinary.
Exactly. And they break down why this seemingly minor detail can be, well, kind of a big deal.
Oh, yeah. It can be a sign of a lot of different things.
Like a hidden clue, right?
Exactly. Little medical mystery.
So let's break it down. What exactly is microscopic hematuria and why should we care?
Okay, so in the simplest terms, microscopic hematuria just means there are red blood cells in your urine.
Okay.
But they're so tiny you need a microscope to see them.
Ah, I see.
And as you said, it's not something you'd notice on your own. There's no change in the color or anything.
So it's kind of stealthy, huh?
Exactly. It can.
Sneaky little thing.
It is, and while it's not always a cause for alarm, it can definitely be a signal that something's off in your urinary tract.
Right, which I guess is like the whole system that filters waste and makes pee.
You got it. Your kidneys, your ureters, your bladder, your urethra, the whole shebang.
So that's where urologists come in?
Yeah, they're the specialists for all that.
Like the folks at Advanced Urology.
Exactly.
They deal with all things urinary tract.
I've seen it all.
They have a whole list of potential causes too, right?
Oh, yeah.
Like from, simple UTIs and kidney stones.
Right.
To things like kidney disease and even cancer.
In rare cases, it's definitely worth getting checked out.
That's quite a range.
It is.
But the tricky part, as you said, is that you might not have any noticeable symptoms.
Right. You could have it and not even know it.
That's why those regular checkups are so important.
Exactly.
Got to get that urine tested.
Especially as you get older.
It's easy to put those checkups off, but they can really,
Yeah, they can be lifesavers.
So true.
Early detection is key for a lot of things.
Absolutely.
Now, sometimes you might have some other symptoms that pop up along with the microscopic hematuria.
Okay, like what?
You might have pain or burning when you pee, or you might feel like you have to go more often.
Oh, okay.
Or you might have pain in your flank or lower back.
So those are red flags, basically.
Yeah, if you notice anything like that, definitely go see a doctor.
Good advice.
Better safe than sorry.
So let's say our listener, just got the news that they have microscopic hematuria.
Okay.
What happens next?
Well, the first step is finding a good urologist. And I have to say, if you're in Georgia, Advanced Urology is the place to go.
They really are top-notch.
They are. They have a great team.
So you've got your appointment.
Okay.
What can you expect when you walk in the door?
Well, first, they'll probably ask you about your medical history, any meds you're taking, and any symptoms you've been having.
Okay.
And what's interesting? Some medications can actually cause microscopic hematuria.
Really?
Yeah, like some pain relievers and even antibiotics.
Huh. I had no idea.
They can irritate the urinary tract, and that can lead to some bleeding.
Interesting.
Yeah, so it's super important to be honest with your doctor about everything you're taking, even over-the-counter stuff.
Good point.
So they're gathering all this information like detectives,
right.
trying to figure out what's going on.
So after the initial chat, what happens?
Well, they'll probably want to confirm that there's actually blood in your urine, so they'll do another urinalysis.
Okay.
And they might also do a urine culture to check for a bacterial infection.
Because UTIs, again?
Exactly. They're very common.
Makes sense. So they're ruling out the usual suspects.
Right.
But what if those tests don't give them a clear answer?
Well, that's when they might bring in the big guns, the high-tech stuff.
Like what?
Like imaging techniques.
Oh.
Ultrasound, CT scans, MRI.
Oh, okay.
Those can give them a really detailed look at your kidneys, bladder, and everything in between.
So it's like having X-ray vision for your urinary tract.
Pretty much.
Wow.
They can spot things like kidney stones, tumors, or any structural abnormalities.
Interesting.
Yeah, it's pretty amazing technology.
So they've got a lot of tools at their disposal.
They do.
To figure out what's going on.
They do.
That's good to know.
It is. And they have another tool, too. It's called cystoscopy.
Yeah, that was mentioned in the material we have.
Yeah, it might sound a little intimidating, but it's not that bad.
Okay.
Basically, they insert a thin, flexible tube with a tiny camera on the end into your bladder.
Wait, a camera?
Yeah, they can actually see inside your bladder.
Wow.
The camera sends images to a monitor, so the urologist can see the lining of your bladder and check for any signs of inflammation, growths, or stones.
So it's like sending a tiny scout in there to gather intel.
Exactly.
But what if they don't find anything?
Okay.
What if all the tests come back normal?
Well, in that case, it might be a bit of a waiting game.
Okay.
If they can't find a specific cause right away and the microscopic hematuria isn't considered high risk, they might just recommend monitoring it over time with regular urine tests.
I see.
And they might also suggest some lifestyle changes, like drinking plenty of fluids, avoiding certain medications that can irritate the bladder, and maybe taking it easy on strenuous exercise.
So it's not always a cause for major alarm.
Right.
But it's definitely worth investigating.
Absolutely.
And that's where choosing the right specialist, like the folks at Advanced Urology, comes in.
They really know their stuff.
They do.
And they'll take good care of you.
But before we get ahead of ourselves,
Okay.
we've got to talk about the C word.
The big one, yeah.
Cancer.
Right.
How often is microscopic hematuria actually a sign of something that serious?
Well, it's important to remember that while cancer is a possibility, it's not the most common cause of microscopic hematuria, especially in younger people.
Okay, good to know.
But it's definitely something that needs to be ruled out, especially in older adults or people with certain risk factors.
Like what?
Like a family history of bladder or kidney cancer, a history of smoking, or exposure to certain industrial chemicals.
So don't panic, but...
Don't ignore it either.
Right.
Get it checked out.
Knowledge is power.
Exactly, and that's what this deep dive is all about.
We want to give you the information you need to take control of your health.
To make informed decisions.
Now, are there any situations where you should, immediately seek medical attention, even if you're not experiencing any other symptoms?
Yeah, good question. If the microscopic hematuria keeps showing up on multiple urine tests, that's definitely a red flag.
Okay.
And if you have a family history of kidney or bladder cancer, you should definitely let your doctor know about that right away.
Makes sense.
And of course, if you start seeing visible blood in your urine, that's an immediate call to action.
Right, no question.
Definitely go to the ER or see your doctor ASAP.
Okay, so we've covered a lot of ground here.
We have.
Microscopic hematuria, often silent, potentially significant,
It can be.
and always worth investigating.
Definitely.
But before we move on, I want to touch on something I think is relevant to our listeners today.
Okay.
You mentioned that the causes can vary widely.
It does, yeah.
What are some of the more common culprits?
Okay, so some of the most common causes are urinary tract infections, especially in women.
Right, UTIs.
Yeah, those usually come with other symptoms like pain or burning during urination, having to pee all the time, and sometimes even fever.
Okay.
Kidney stones are another common one.
Yeah?
Those can cause intense pain in your back or side that comes and goes in waves, and you might also see blood in your urine with those.
Ouch, yeah.
Yeah, not fun.
So pain is a big clue in those cases.
It usually is.
What about an enlarged prostate?
Ah, yes, benign prostatic hyperplasia, or BPH.
Okay, BPH?
Yeah, that's very common in men as they get older.
Okay.
And it can cause microscopic hematuria.
And
It's not cancerous, it's just an enlargement of the prostate gland, which is part of the male reproductive system.
right.
Men with BPH often have symptoms like trouble starting or stopping their pee stream, a weak stream, and needing to go frequently, especially at night.
So those are some of the more common, less worrisome causes.
Right, usually.
But what about those red flags that might suggest something more serious is going on?
Okay, so if you have microscopic hematuria that just keeps coming back and you don't have any other symptoms, that's something to get checked out, for sure.
Okay.
And any unexplained weight loss, fatigue, or fever that just won't quit, those are all red flags too.
So basically, pay attention to your body
Exactly.
and don't hesitate to see a doctor if something feels off.
Right, trust your gut.
Early detection is key.
Absolutely.
All right, folks, we've covered a lot of ground in this first part of our deep dive into microscopic hematuria.
Yeah, we have.
We've talked about what it is, why it matters, and some of the things that can cause it.
The basics.
But we're not done yet.
Not even close.
When we come back for part 2, we'll dig deeper into the diagnostic process.
We'll talk about all the cool technology they use.
Yeah, and we'll explore the different treatment options available depending on the cause.
And we'll answer more of your questions, so stay tuned.
Sounds good. We'll be right back.
Welcome back to our deep dive on microscopic hematuria.
Okay, so before the break, we talked about what microscopic hematuria is and why it's important.
Right, the basics.
Now let's get into the how. How do doctors actually figure out what's causing it?
Exactly, the detective work.
Right.
So we left off talking about those diagnostic tests, and remember, it all starts with confirming there's actually blood in the urine.
So that first urinalysis is like the first clue.
Exactly, yeah.
Okay, something's up here, we need to look into this.
Right, and then usually they'll do a urine culture to check for bacteria.
Right, because UTIs are so common, especially in women.
Exactly, it's a common culprit.
And the material we have from advanced urology, they really emphasize the importance of identifying that root cause,
Absolutely. Got to find the source of the problem.
which often involves those imaging studies.
Yeah, the high-tech stuff.
Right.
Things like ultrasound, CT scans, MRI.
Okay.
Those give doctors a really detailed look at your kidneys, bladder, and all the surrounding structures.
So it's like having X-ray vision for your urinary tract.
Pretty much, yeah.
Wow.
They can see things like kidney stones, tumors, or any structural abnormalities that might be causing the bleeding.
So they can actually see what's going on in there?
Yep,
That's pretty wild.
it is.
And I remember they mentioned cystoscopy, too.
Ah, yes, the cystoscopy.
Which sounds a little more,
Invasive.
yeah, it involves inserting a thin, flexible tube with a camera on the end into the bladder.
Wait, a camera? They actually put a camera inside your bladder?
They do, but it's not as bad as it sounds, I promise.
Okay.
It's a very well-tolerated procedure.
Right. And it allows the urologist to directly see the lining of your bladder.
Wow.
They can check for any inflammation, growths, or stones that might be causing the bleeding.
So it's like sending a tiny scout in there
Exactly, a little explorer.
to gather intel.
Exactly.
Okay, so depending on what they find with all these tests,
Right.
the treatment will be tailored to the specific cause, right?
Absolutely. It's not one size fits all.
Okay, good.
If it's a UTI, antibiotics are usually the answer.
Right.
For kidney stones, they might use pain meds, tell you to drink lots of fluids, or even do a procedure to break up the stone.
Okay.
If it's an enlarged prostate, there are meds to shrink it or surgery to remove excess tissue.
So each case is unique.
Exactly. Every patient is different.
And that's why it's so important to see a qualified urologist,
Absolutely. Someone who knows what they're doing.
like the team at Advanced Urology.
Oh, yeah, they're fantastic.
Okay, good to know.
They can accurately diagnose and recommend the right treatment plan.
But what happens if all the tests come back normal? Like they can't find anything wrong?
Well, in that case, they might just recommend monitoring the situation.
Okay.
You know, keep an eye on it, see if anything changes.
So a wait-and-see approach.
Exactly.
They might also suggest some lifestyle changes.
Right. Things like staying hydrated,
Drinking lots of water.
avoiding certain meds that can irritate the bladder.
Oh, eh?
And maybe taking it easy on strenuous exercise for a while.
So it's not always a huge red flag,
Not necessarily, no.
but it's worth investigating.
Definitely.
Okay, but we got to talk about cancer.
Yeah, I know. It's the scary one.
How often is microscopic hematuria a sign of something that serious?
Well, it's important to remember that cancer is relatively rare, especially in younger people.
Okay, good to know.
But it's definitely something that needs to be ruled out, especially if you have certain risk factors.
Like a family history of cancer.
Exactly. Or a history of smoking.
Okay,
Or exposure to certain chemicals.
so don't freak out.
Right, but don't ignore it either.
Get it checked out.
Eh.
All right, good advice.
Better safe than sorry.
So we've talked about the tests,
We have
the possible causes, the treatment options.
the whole shebang.
What are some key takeaways from this part of our deep dive?
Okay, well, I think the most important thing is that even if you don't have any symptoms, microscopic hematuria can still be a sign of something going on.
Right, that silent thing.
Exactly. So it's important to see a urologist and get it checked out.
And even though the whole diagnostic process might seem a little scary, there are some amazing tools available to help figure out what's causing the bleeding.
Oh, yeah, technology has come a long way.
And even if they don't find a specific cause right away, there are still things you can do to manage it and stay on top of your urinary health.
Absolutely, like those lifestyle changes we talked about,
So stay tuned for part 3 of our deep dive.
where we'll talk about the latest advancements in research and some tips for preventing urinary tract problems.
Sounds good. We'll be right back. And we're back for the final part of our deep dive into microscopic hematuria.
All right, so we've talked about what it is, how it's diagnosed, and what the treatment options are.
Right, we've covered a lot of ground.
Now let's shift gears a bit and talk about what's on the horizon.
Ooh, I love talking about the future of medicine.
It's an exciting time, for sure.
So what are researchers working on when it comes to microscopic hematuria?
Well, one area of active research is focused on developing even more sensitive and specific tests for detecting blood in the urine.
So even better than what we have now.
Exactly.
Makes sense. Got to catch those early warning signs.
Right, early detection is key.
So what kind of tests are they working on?
Well, scientists are exploring new biomarkers.
Biomarkers.
Yeah, they're like molecular clues that can indicate a specific condition.
Oh, okay.
And they're also working on more advanced imaging techniques.
Wow, so even more high-tech stuff.
Yeah, pretty much.
Why are they doing all this?
Well, the goal is to be able to distinguish between benign and more serious causes of microscopic hematuria with even greater accuracy.
Ah, I see.
So if they can pinpoint the exact cause, they can tailor the treatment more effectively.
Right, so less guesswork, more precision.
Exactly, and potentially avoid unnecessary procedures for people who don't need them.
That's a big win.
It is.
Less stress, better outcomes.
Absolutely.
What about on the treatment side of things? Any new therapies in development?
Oh, yeah, that's a lot happening there, too.
Like what?
Well, researchers are investigating new minimally invasive treatment options for some of the underlying causes of microscopic hematuria, like kidney stones.
Oh,
For
okay.
example, they're looking into using high-intensity ultrasound waves to break up kidney stones.
Wait, really? How does that work?
It's pretty cool, actually.
Okay.
They focus these ultrasound waves on the kidney stone, and the waves generate enough energy to break it into smaller pieces.
So no surgery.
Exactly, it's non-invasive.
Wow, that's amazing.
It is, and it could potentially revolutionize the way we treat kidney stones.
So less pain, faster recovery.
Absolutely.
And what about other conditions?
Well, there's also a lot of interest in personalized medicine approaches.
Personalized medicine.
Yeah, so basically tailoring the treatment to an individual's specific genetic and molecular profile.
Oh, interesting.
So instead of a one-size-fits-all approach, it's more like a custom-tailored treatment plan.
Makes sense. Everyone's different.
Exactly, and advancements in genetic testing and molecular analysis are making this level of personalization increasingly possible.
That's pretty incredible.
It is. It's a really exciting time to be in the field of medicine.
So we're talking about potentially revolutionizing the way we diagnose and treat these conditions.
Absolutely. The future is bright.
Okay, before we wrap things up, I want to circle back to prevention.
Okay, good idea.
Are there any things people can do to reduce their risk of developing microscopic hematuria in the first place?
Absolutely.
Like what?
Well, the most important thing is to stay hydrated.
Drinking lots of water, right?
Exactly. Aim for at least 8 glasses a day.
Why is that so important?
Well, it helps flush out your system and prevent urinary tract infections.
Ah, okay, so water's our best friend.
It really is.
What else?
Pay attention to your bathroom habits.
Like what?
Don't hold it in for too long.
Okay,
That can increase your risk of a UTI.
gotcha.
And if you do experience any pain or burning when you pee, see a doctor right away.
Okay, so early treatment is key.
Absolutely.
What about diet? Does that play a role?
It can. Certain foods and drinks can irritate the bladder.
Like what?
Caffeine, alcohol, and spicy foods are common culprits.
Okay, so maybe cut back on those.
If you're having problems, yeah.
And if you have a history of kidney stones, talk to your doctor about dietary changes.
Right, they might have specific recommendations.
What about things we can't control, like age and genetics?
Yeah, unfortunately, there are some risk factors that are unavoidable.
Okay.
As we get older, our risk of certain conditions, like enlarged prostate and bladder cancer, increases.
Makes sense.
And if you have a family history of those conditions, you might be at higher risk.
So it's all the more important to be proactive and get those regular checkups.
Absolutely. Early detection is always the best approach.
All right, folks, as we wrap up our deep dive into the world of microscopic hematuria, I want to leave you with a few key takeaways.
Sounds good.
First, remember that microscopic hematuria often doesn't have any noticeable symptoms.
It's a sneaky one.
So those routine urine tests are super important.
They are.
Second, if you do get diagnosed with microscopic hematuria, don't panic.
Right. Most cases are benign and treatable.
But it's crucial to see a qualified urologist to figure out what's causing it and get the right treatment.
Absolutely. Find a doctor you trust.
And finally, be proactive about your urinary health.
Right. Take care of yourself.
Stay hydrated, listen to your body, and see a doctor if something feels off.
Good advice.
All right, that's all the time we have for today.
Thanks for joining us on the deep dive.
We'll catch you next time. If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.